Hi guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Clonazepam, also known as Klonopin. It's another benzodiazepine. It's approved for panic disorders, seizure disorders. Now off-label, it's used for a lot of other things. I don't want to get into all that. There's a lot of stuff it can be used for. Generally, you take it 1 to 3 times a day, depending on what your diagnosis is, what your doctor is comfortable with you taking. Let's see here. The mechanism is always a little complicated, but it works on your GABA receptors. So it essentially works to reduce your neuron firing, meaning we're trying to calm you down, right? So we're trying to get less neurons firing, because the more you do something, you go run outside, you get anxious, or you think about a lot of other things, that means your neurons are firing in your brain really, really quick, right? So what we're trying to do is we're trying to get them to fire less so that you're calm. And that's kind of how it works. Let's see here. It generally kicks in at about 20 to 40 minutes. When you start to feel it, you'll feel the full effect in about an hour or so. So it's a quick acting. That's what makes it so different from like alprazolam and temazepam and flurazepam and all the other ones out there. Let's see here. It's got a black box warning. Do not take these things with opioids. Do not stack them. I know we've talked about it in other videos, but a lot of people will take Vicodin with Klonopin, and that's a terrible, terrible idea. It causes respiratory depression. And your breathing will literally go down. And if your breathing goes below a certain threshold, then you'll die. So we don't want that. And a lot of people party on these things. Don't party, don't drink, and then take opioids, and then take Klonopin. Because a lot of times what ends up happening is that a lot of cases we've seen is people pass out and then they'll try to throw up, and then this medication prevents that. Again, we're not firing, so we're calming your entire body down. Your body's unable to throw up, and so you choke and die on your own vomit. So that's terrible. We don't want that to happen. So don't stack these things, okay? This is not a party drug, all right? Woo! This is not a party drug. Don't do that, okay? If you, it does go through your liver, so if you have any liver or even renal issues, make sure that your doctor knows about all the different medications that you're taking, because we don't want you to stack too much of this stuff and tax your liver and your renal system. Pregnancy, I couldn't find exactly what the pregnancy class is for this, but it's teratogenic, meaning it is harmful to the fetus. So the point is, you don't take this medication when you're pregnant. And then also, it is detectable in breast milk. However, there's this thing called relative infant dose. So a certain percentage of clonazepam in breast milk is acceptable for the baby to take. So your doctor needs to be checking your breast milk for levels of this medication, because if it's too high amount that's found in the breast milk, that's harmful to the baby. But if it's a small amount, then it's medically acceptable. So just watch out for that. Here's a list of side effects I'm going to put up here. When we're dealing with medications in the brain, you can see a very large, broad spectrum of side effects that you can see go on, right? So just watch out for that. Anything out of the ordinary, anything that's discomfort, uncomfortable to you, let your doctor know. Then we need to switch you either on lower doses or switch you on a different medication altogether. And it does have the dependency issues. So this is a class control medication. So if you take it long enough, your brain will physiologically become a little addicted to it. And then so you have to taper off whenever it is that you're ready to get off this medication, which means you take less and less over a period of time to get you off the medication. And just keep that in mind. There is a dependency and an addiction potential with this medication. You don't ever want to be addicted to medications. That's terrible, but a lot of people are. We're seeing this out in practice, and patient education is really all we can do from our standpoint. So just guys, watch out for that. And talk to your doctor. Try not to take more than you need to and things like that. If you want to get into the whole emotional discussion of this medication, go to our other video over that's just about benzodiazepines, where I talk about addiction and withdrawal on a much deeper level than I want to here. But I just don't want to end up repeating myself. But go to that video. We go into all the basics of, not even the basics of detail, of just how this all works when it comes down to withdrawal and dependence on your brain and it taking a hold of you. And yeah, so I'll leave it to that. But guys, if you have any questions, leave it down in the comments. Like the YouTube page, and spread it around to friends and family. If these videos are here to help, so get them in the hands of people that will help. And let us know what other videos you want us to make. And we'll see you next time on Meds Made Easy. Bye.